Good evening. I'd like to officially welcome you all to this session. Let's invite our friends to join us. Yeah, let's invite our friends to join us. Whoever joins in this particular webinar is going to be granted a free account for the first month. So let's tell our friends about the opportunity so that they can also benefit from it. Yeah, if you are tuning in and you want to get a free account or you have any questions, feel free to just post down a comment. We are actively replying to comments in real time. So I will be demonstrating quite a number of things available on the platform and how we can use the NMCZ Ready platform to prepare for exams. So you're welcome. Let's invite our friends. Let's tell them that the program has started and that we are about to begin. All right. So I will start by opening the NMCZ Ready platform itself. All right, so I'll be sharing my screen. The question that we're all pondering today is why failing nursing exams is so easy nowadays. Why failing nursing exams is so easy nowadays? Well, there are three things that we're going to base our webinar on today. And on top of that, I put starting today. So with me here is what the platform looks like, the NMCZ Ready platform. When you open our website, either you access it as an app or you access it as a web page. This is the screen that you're initially brought to. The platform has got two modes. We have got the study mode, which is right here, and we also have the exam ready mode right there. Part of the controls, you've got a place where you can search for apps. It doesn't matter what gadget you're on, and you can also refresh the page from this button here, and you can also change between modes depending on what your preferences are for lighting. We've got the dark mode, and we also have the light mode. So I will go straight into the study mode. What is found here, for those of you might be wondering, the first thing that you can use this app for is to set a timetable. Sometimes why people fail exams is because they don't have a plan. So one of the first things that we're looking at in this video is to have a plan. So how do you prepare for a plan? When you open the platform, you select the courses that you would like to prepare for exams for, and you set the duration from here. Let's say, for example, you're doing public health nursing, and the only courses that are catered for in your third year are leadership and management and pediatrics. You just have to deselect the following courses and you create a timetable for the two. If you're in your second year, it means all these are applicable except for leadership and management. So you get to select the four. You remain with the five. You get to select the four and deselect the two. Then you can set your study period. Set your study period to, let's say, for example, the perfect timing or the perfect time to start studying is the earliest time possible. Don't wait for a month until exams are around the corner for you to start studying. Start studying as soon as possible. So we're going to set our duration to 90 days, which is 3 months, for example. When I set my duration to 90 days, I'm going to click generate timetable right there. It builds the timetable for me and it tells me my timetable for the courses that I have selected is valid for 89 days. So meaning on a daily basis, I have to study three conditions per day. And if you can see how it structures the timetable, it mixes courses. We have medicine and medical nursing and IRH because rheumatoid arthritis, fertilization is from IRH and breast cancer is from IRH. So that is one way, having a plan and using the platform. you can create a plan when you don't know where to start from. When you go to see my plan or go to my plan, you are given this section where it shows you what your daily schedule is and your timetable for the next 65 days. So for the courses that we had selected and the period, you only need 65 days to complete studying them, and it gives you a list of topics you are done with, and it cancels out the ones that you've studied. So the ones that you haven't studied, you find them. The ones that you have will be cancelled out like that. Let's share this link with other friends of ours who are not watching this live, as they will get the opportunity to get free accounts on the platform. I will be taking questions live in the comment section wherever you're watching us from. You can just drop a question in the comment section. Right, so now the other, you will find 6 courses: IRH, Leadership and Management, Medical Nurse. Right, so I'll just let this load here. Wherever you're watching us from, don't forget to share the link with others. All right, so like I was saying, the topics in medicine and medical nursing are split into folders. You've got the cardiovascular system. When you say start topic, you see a list of topics lined up like that. So we're going to select, for example, hypertension. When you select hypertension, there's a notes section right there, and there's also an audio lesson right there. Then when you click audio lessons, you will find a list of recorded audio notes for the lesson. What this does is, as you play these, you can also review notes as you play the audio lesson. You can adjust the playback speed like that. And then you also have the video section. The video section caters for a number of videos on one particular topic. You're not only given one video, but you're given quite a number of videos on one particular topic. For example, we have got one from osmosis.org. We also have another video on hypertension from a different source. And we also have another one just talking about the pathophysiology. Yeah, so on the platform, you're given 3 forms of study resources. Back to the home screen, we're going to open the exam ready mode. So for this particular mode, what it does is it gives you the same number of courses. Let's open medicine. We're going to open the very condition that we had opened earlier, which was hypertension. You select your topics from there. Once you've selected your topic, you've got a section called Simplify this condition. This section breaks down the selected medical condition into simple, easy to understand steps. For example, the introduction has been outlined, the definition has been outlined, the etiology has been outlined, as well as the predisposing factors and signs and symptoms. Going further, you've got the other section, which is known as the Management Hub. So I'll scroll down. In the Management Hub, we've got the conditions medical management outlined in full. So you can see the diagnosis starts with history taking, and the examiner at this particular point wants to see you write the heading as history taking and explain how you would conduct your diagnosis by taking history. When you go down further, you see where it's written physical examination. And going down further, we've got laboratory investigations, radiological and cardiac tests, as well as the treatment. Treatment outlines lifestyle modifications, classification of drugs. For example, we've got diuretics. Under diuretics, there's a drug name there. Going down further, we've got beta blockers. So we give you a number of classes that are used in the treatment of the condition that you're trying to study. When you're done with the medical management, the next section is the nursing management. Here, there's a format. There's what they call a prophenema, which we learned when we were in training as well. A prophenema is simply an acronym that helps you know how to arrange your headings. So here you've got your environment, followed by your positioning, followed by psychological care, then followed by observations. Furthermore, we've got your rest and sleep, followed by prevention of infection, as well as hygiene. Then after that, we have the elimination, followed by nutrition. Furthermore, we have exercises. We have your medication there, all the way up to the very last heading, which is the IEC, Information, Education, and Communication. So that is one way you can use this platform to study when you're preparing for exams. There are managements written specifically for each condition. Right, so having looked at the exam ready mode, we are going to go back to the home screen. And the next section that we're exploring is called Track My Progress. Let's invite our friends. Wherever you're watching us from, just drop a comment in the comment section. Tell us where you're watching us from and drop us your email address so that we can see what status your account is in. If you do not have a premium subscription or a paid account, by virtue of joining this webinar, your account is going to be upgraded. So let's share the link with our friends. I'll take a short break for now as we wait for others to join us. Our friends, where are watching in section, tell us where you're watching us from so that we can see what's the premium subscription or a paid account. The account is going to be up. I'll take a short break for now as we wait for others to join. All right, so I'm back. Let's keep inviting our friends to join this webinar. The whole essence of having this live session is so people can drop comments, ask questions on certain things that they have that they're not sure about on the platform. One of those questions would be, how can one use this platform to prepare for nursing exams, be it NMCZ, be it your CA, be it your end of year exam, be it your end of semester. So those are the questions that we're addressing. Just drop a comment in the comment section and we are going to reply to it as soon as possible. Furthermore, I am going to open a section called the Advanced Tools. What you find here, ladies and gentlemen, is quite interesting. We have the terminologies library, which has got terms to be defined. For example, terms related with mania. Like you can see, you've got bipolar, erythromania, nymphomania. So let's open one of them. You've got your definition outlined right there. The beauty about using the platform is when you're studying, you do not have to open a different app like a dictionary to define a term or search for a certain terminology. You just search for it from here and your terminology will be within one space. And then we have got the nursing care plan generator. When you open this one, it leads you to a new app, which is our secondary app. When you open it, what's found in this app, initially on the home screen, you're going to find what's showing us this. You can switch between modes from either of our apps, the first one or this one. We've got sections here. For those of you who are using mobile devices, it may display like this. So for those who are using mobile devices, it may display like that. So what you can do is just simply tap the three lines in the corner there, scroll down to the nursing care plans, and then you can select a course. For example, let's select mental health and psychiatry. So I'll switch back to my current screen. And then after selecting your course there, you can now type in the condition that you want to generate a care plan for. Let's say we want to generate a care plan for epilepsy. So you just type down epilepsy like that and say generate care plan. Then you wait for it to verify that you are a plus subscriber. After it verifies your credentials and that you are a plus subscriber, then you are going to see your nursing care plan generated. Previously, I had generated a care plan for asthma, so I'm going to open it. When you open that care plan you had generated previously, you're given a list of 4 actual problems. So I'll zoom in. There are 4 actual problems and 2 potential problems. For the actual problems, they are going to be lined up first and followed by a potential problem. So we've got problem 1, problem number 2, problem number 3, number 4, 5, and number 6. Let us start with problem number 1. So problem number 1, let's keep inviting our friends. Let's keep inviting our friends. Okay, leave a comment in the comment section. Tell us where you're watching us from. We are going to proceed. So our nursing care plan, as I was explaining earlier, has got the following things. For a nursing care plan that you generate every time, it's stored in the saved academic library. So you just open it from there. When you do that, your list of problems are here. Then you can scroll down and see. So the problem identified is ineffective airway clearance related to bronchospasm and increased mucus as evidenced by wheezing and cough. Then your goal has been outlined, which is SMART, meaning specific, measurable, attainable, realistic, and time-bound. The patient will maintain a clear airway as evidenced by normal breath sounds within 8 hours. Right, so moving in that direction, I hope you're all following. Then your interventions are outlined. I will auscultate breath sounds every 2 hours in order to detect signs of airway obstruction or mucus buildup. And the rationale for every intervention is provided. It tells us that regular monitoring helps identify worsening airway constriction, which are early for prompt intervention. And also, intervention number 2 states that I will encourage the patient to drink at least 2 liters of fluid daily in order to thin thick mucus secretions. So this is one resource that you can use on the platform, which is called the Nursing Care Plans. To access this, just come to the 3 dots there, 3 lines, scroll down to Nursing Care Plans, select a course, for example, medicine, and you can type in your condition from there, for example, anemia. When you type in your condition, just click generate, and you should be able to have access to the care plans that you have generated. I had also generated a care plan on tetanus in pediatrics. When you open it, it gives you the same 6 problems. You can switch between modes, like I had said earlier, and you can review the nursing care plans written. After the interventions, you have the evaluation written here. So what it looks like when you zoom in, it says the patient maintained a clear airway and normal breathing patterns within 24 hours. The goal was achieved. So I will take a short break so that others can join us and just attend to comments. Thank you for staying glued to the stream. Let's continue where we had ended. All right, so we were looking at the care plan generator function right there. Furthermore, to the features that are found on the platform you can use for exam preparations include the board mock exams. Okay, leave a comment in the comment section. So when you open it, what happens is that you are given a list to choose between 5 questions mode or the 10 questions mode. Then the question type is with the multiple choice, the fill in the blanks, and the matching. So let's say, for example, we want to go with multiple choice questions. I generated a question on multiple choice questions. So when you say revisit quiz, it takes you back to the quiz that you had initially attempted. So that's how the platform works. It stores the quizzes that you had attempted, and you can simply just attempt them back. Okay, so that's one way that you can access resources on the platform. Furthermore, from that, we've got the 10 questions modes to which you can generate fill in the blanks questions. Let's say, for example, the course that you want to attempt is pediatrics and pediatric nursing, specifically respiratory distress syndrome. So you can type respiratory distress syndrome and simply say start quiz. When you select that, it starts generating the questions. Meanwhile, like you can see a list of quizzes that you had generated, and you can simply just retake them. For example, for this particular quiz, which was a 5-question mode, it reads the primary bacterial pathogen responsible for the development of most cases of chronic erosive gastritis is, I would put E. coli, for example, E. coli, and say submit. So it says Helicobacter pylori is a spiral-shaped bacterium that resides in the mucus layer of the stomach and is the leading cause of chronic gastritis and peptic ulcer. So this response of ours is incorrect. You can go to the next question, and it says autoimmune gastritis often results in the destruction of parietal cells, leading to the deficiency of DASH factor and a subsequent vitamin B12 malabsorption. So it's called a deficiency of the intrinsic factor. So we say intrinsic factor, and you say submit. So let's just correct the spelling there. Say submit, and then it tells us parietal cells secrete intrinsic factor. So meaning this response is very much correct. While necessary for the absorption of vitamin B12 in the ileum. So autoimmune destruction of these cells is in chronic gastritis leads to a deficiency of the intrinsic factor. You go to the next question. So it says to monitor for potential gastrointestinal bleeding in a patient with acute gastritis, the nurse should regularly perform a DASH test on the patient's stool. So let's say I don't know what the answer is and just put a random answer. And say what do you call this? We just put a stool test, for example. A stool test. I'm trying to demonstrate how you can use this when you're blank as a student, basically. So yeah, I'm trying to demonstrate how you can use this when you're blank as a student. So say submit answer, and it tells us to say a stool Geiger test, which is FOBT, is used to detect the presence of fecal occult blood, which can indicate erosive gastritis or hidden bleeding from the gastric mucosa. Great. You say next question. And then it says the pharmacological management of gastritis often includes DASH, a class of medications that block the H2 receptor on parietal cells to produce hydrochloric acid, to reduce hydrochloric acid. So we say antacids, and then say submit. So it says histamine 2 receptor antagonists such as formatidine. It competes with the histamine for H2 receptors on the gastric parietal cells, thereby reducing acid output and irritation. I'm deliberately putting wrong responses so that you can just comprehend how the platform helps you correct certain mistakes that we make during an exam. Tell us where you're watching us from. Feel free to share the stream with other students to join us. Whoever joins and drops a comment in the section, leaves a like and a sub, is going to be given a free account on the NMCZ platform to access all these things free for 1 month. And say submit. So we go to the next question. A patient with chronic gastritis is at increased risk of developing dash anemia due to inability to absorb vitamin B12. So we say um, megaloblastic anemia, and say submit. So it says pernicious anemia is a type of megaloblastic. So we were correct, except we just wasn't specific. So it says pernicious anemia is a specific type of megaloblastic anemia caused by a lack of intrinsic factor and a condition often associated with autoimmune chronic type A gastritis. I hope we're following. And then you say next question. So you can simply revisit the quizzes that you had and it rates you like that. So it says for this particular quiz, because we didn't attempt it initially, we had 0. So we're going to generate our own quiz. And the quiz that we're going to generate, for example, is just basically on respiration. So we say respiration and say, so let's take it back to the nursing care plans, back here and say respiration. So we're going to go with a multiple choice and say start please. So I'll take a short break as it's generating this quiz. All right, we're back. And if you're still watching us, just drop a comment as to where you're watching us from. And if you're not already on a paid account, please drop your email address in the comment and your account is going to be activated. So I'll be taking us back to the screen we were on. Right. So I was showing you guys how you can use the platform to generate quizzes. There are various modes you can use. We have the multiple choice section, fill in the blanks and matching. Whenever you select the quiz, it starts preparing it. Once the quiz is done, you have it saved here, meaning you can revisit it at any time and practice on the platform as you study. There are other academic tools on the platform, such as the terminologies, the calculators for drugs, administration of fluids, as well as your preferences section where you just get to play around with your details. Now allow me to take us back to our main app. For those of you who might not know how we got here, it all starts with our official app, which is the NMCZ Ready app. And how to have access to this app is very simple. You just open your browser and type nmczready.com and click enter. When you enter, if you do not have an account, you're going to bump into this screen as a first-time user. So what you do as a first-time user, you just come down to sign up. And here where it says sign up, you'll be required to put in your details, your email address, your password, the program that you're doing, the level of training. For diploma holders, you can put any of these. For those being higher than 3 years, you can go for higher. Put your NRC or passport number, as well as the university that you're coming from or the college. Referral code is optional. For those who have been referred to the platform via referral code, you'll be asked to use this. But if you don't have one, just leave it blank. Say agree to terms and say create account. When your account has been created, you come back to the sign in page, put in the very details that you had used and say sign in. And when you're in the platform, you're given these options here. The track my progress section helps you track how you're moving in terms of studying, in terms of what courses you're studying, and how many topics you've covered so far. So how do you get the platform to track what courses you've studied and how many topics you're left with? Just pick any course. We're going to open it in the study mode. Once you do that, wait for the courses to load. And let's say select IRH, which is Integrated Reproductive Health. Then you can open any of the folders. For example, let's say labor. The check marks that you're seeing here are what you need to tick whenever you're done. So the moment you just tick any of these or uncheck it, this affects your progress in a course. So for example, I'm going to deselect these and say back to systems. My overall percentage in terms of progress includes the following. So we have the overall progress at 67. I'll get back and reselect those courses. So I'll select this one to say I've studied this, I'm good. I've studied this as well, and this and that, and say back to systems. We're going to see the percentage immediately change in terms of IRA. So it was at 67 and now it's at 80%. So that's how you can track and move. You can track your progress on the app using that method. Yeah, so that was the track my progress section. Feel free to drop a comment in the comment section. If you have any question, any query, we're attending to comments in real time. As long as you drop a comment, leave a like and sub, drop your name or email address. If you're already a subscribed user, you get a free subscription for the following month. If you're not a subscribed user, you get the subscription free for this month. And if you are on a basic plan, it automatically gets upgraded to the plus plan. So we're immediately going to take a short break as we wait for others to join and attend to other comments. All right, we're back. We are back. And with me here, the screen that I'm currently on is the main screen for the NMCZ Ready dashboard. And like I had said, you're at liberty to search for a condition here. When you do, you have two modes which you would like to open them in. This is for those who are studying ahead of the class or those studying to catch up with the class. This one is for those who are trying to prepare for exam, meaning the literal sense of why you're studying is so that you can now align your thoughts to exam preparation. And when you open it, this section is specifically tailored to what the examiner might want you to ponder in the essay questions. Your definition, types, predisposing factors, causes, signs and symptoms, and complications come as your question A, B, or question D. Sometimes C. Then your essay question, which is 50 marks, comes as medical management or nursing management. Now allow me to go to surgery and surgical nursing. So I'm going to go back to courses and open surgery and surgical nursing, or preferably just search for a condition, and I'll search for ruptured spleen. Ruptured spleen. So ruptured spleen is a surgical condition, and I'm going to open it in surgery. So in surgery, what you get on the platform is 3 types of management, depending on the type of condition. So the condition itself has the actual condition simplified, definitions, the types, the predisposing factors, the signs and symptoms and complications, while the management hub, on the other hand, has the approach. When you come to management hub, you have the approach, and it says the surgical removal of the spleen, which is called splenectomy. Then the nursing management, you're gonna get 2 options. You have the pre-op and the post-op. So inside the pre-op care, you've got a statement that tells you that this is an emergency. So you need to exercise the preoperative, emergency preoperative care for a ruptured spleen. You have your aims. So you say, I will stabilize airway, breathing, and circulation to protect life while urgent surgery or intervention or radiology is being arranged. You only need 2 aims for this particular section. And also you keep going further. The next one is history taking and admission. So I will take short focused history on the mechanism of injury, time, left-sided chest or abdominal impact, and use of blood thinners to estimate bleeding risk. When you're done with the admission process, you go to primary assessment and resuscitation. So what is written here is literally the mind of a student who's ready to attempt an exam and writes what they would do if this situation had presented itself, which is what the essay questions ask us in the literal sense. And the examiner expects you to write your headings as organized as they are. You say assessment, you conduct your airway assessment and intervention, your breathing, your circulation. You go further to the degree of consciousness. You go to deformities and drugs. When you're done with this section, then you go to immediate condition-specific essentials. For example, I will keep the patient new orally, okay? And also you come to your environment in acute bay. So I will nurse the patient near the nurse's station to allow very frequent checks. I will confirm oxygen and suction, electrical power, and emergency trolley are ready in order to act immediately. And you keep going further, there's positioning. So you have a full outline of what your emergency pre-op needs. When you go all the way down to where the patient has been escorted to theater, and then you give handover to the theater nurse, as well as attending to family needs after that. Then you prepare a post-operative bed unit. When you're done with this, the next section you'll be required to study is this post-op, which has been provided on the platform. So you have a full management specific to each condition. So those are some of the advantages of studying using the NMCZ platform. We're literally giving you what a marking key requires. If you ever work with this app into an exam, you would pass if you never got caught. But that's not the literal sense of what this platform is for. This platform is supposed to help you prepare for exams and not help you cheat in an exam, because you will get caught. Like the main header says, mastering nursing concept, practice with NMCZ style questions, track your progress towards becoming a confident nursing student. So we're going to go on a short break as we try to attend to comments, invite others, leave a like and sub, and get a free account for this month on the NMCZ Ready platform. Okay, we're back. The commercial break is over. The essence of this webinar, ladies and gentlemen, is that we are trying our very best to reach out to nursing students out there who are having challenges with preparing for exams. Your role as part of a live attendant of this webinar is to simply just share the link with a fellow student, tell them about the platform, let them join, and let them get a chance to also benefit from what the platform brings. There are various questions that people revise when they're doing their group discussions, as well as when they're just doing their personal studies and preparations. So the main essence of this platform is so that nursing students, regardless of whether you're coming from a college or a university, you can simply get glimpse of what the examiner expects you to do in an exam, which is why we've got the study mode. The study mode has got 3 particular ways in which you can access the resources on the platform. For example, if you are studying medicine and medical nursing, you are at liberty to study using different forms. And these forms include the 3, but is not limited to. For example, let's open sinusitis. And as we open it, you have got the condition explained there. And we've got the audio lessons, which are played. And as you play them, you can adjust the playback speed so that you can speed up the lesson or just follow it up slowly. And we also have the video section, where you have got at least 3 different links or sources for a better understanding. You've got a video from osmosis.org. You also have a video from another source. You have another video from Lecturio, which is basically expanding your understanding of the condition that you're studying. This allows you to not just be limited to one explanation or one aspect of what the condition entails, but we've got videos from experts and professionals who help you understand complex topics and break them down to simplicity. That's what you find in the study mode. On the other hand, in the exam ready mode, you find conditions that are written. For example, the very condition that we're just from opening, sinusitis, when you open it in the exam ready mode, you're given the condition explained on one side, which is part of what's in the study mode, as well as the full management written, tailored to what the examiner wants you to do when you're asked to manage sinusitis. As you can see, the full management. And the sentences or passages are personalized. For example, the writer says, I will check vital signs, which include temperature, pulse, and respiration, so that fever and tachycardia, the rationale is that fever and tachycardia support active infection. Hypotension or altered vitals may indicate severe disease. So you're checking for vitals in order to detect if there's any alteration in vitals, which may indicate severe disease. You say, I will inspect the nose and face for edema, tenderness, erythema, and perinasal swelling. The rationale for this is that external signs localize the affected sinuses and flag cellulitis. So basically, the platform gives you responses or answers and also gives you rationales. On the other hand, we also explain that part of the app you find the advanced tools. Of these advanced tools, we have the terminologies library, we have the nursing care plans, we have the care plans library, we have a drug dose calculator and a fluid rate calculator. For pharmacology students, you can revise these by simply getting your past paper, attempt the questions and try to confirm if what you're writing is correct by opening this calculator and select whether tablets or liquid. And the other flagship feature on the platform is the care plan generator, of which when you open it, you're redirected to our other site, and on that site, you're going to see a screen that looks like this. For mobile phone users, you'll be able to see something like this. For tablet users, you'll be able to be given a screen like that. And for PC users, you get a full screen like that. So you just tap the 3 lines on the top left corner, scroll down to nursing care plans. If you've already generated care plans, you find them and you're able to visit them like that. If you haven't, then you just have to select a course and you type in whatever condition it is that you want. For example, you want to type in jaundice. Okay. join this and say generate. So the platform generates a care plan for you as it verifies whether or not you're a subscribed user and the like. So that's what you find on the other section. The next is the board mock exams. So this one is an exam preparation center. And what you find here basically is a list of what type of questions. We've got the multiple choice, fill in the blanks and matching questions. And you also find your list of safe quizzes there. So for example, I am looking for tuberculosis. The moment you type that down and select fill in the blanks or whatever type of question that you want and say start quiz, other lessons that have already been generated or quizzes that you had attempted before are going to be displayed down there. As you can see, we have good respiration, anemia, and mania. So for example, let's revisit quiz. This was a cross-match question, and it's asking us the following. Match the abnormal respiratory pattern with its clinical description. The descriptions are down here. So we've got what you're reading here. So what the response that you find, okay, so our nursing care plan is ready for jaundice. Let's just go back and open the quiz. And the quiz that we had opened was, let's open a quiz, for example, on jaundice. It's a fill in the blanks question and say generate. Our recent quizzes are going to appear here, right? So respiration was our quiz. We open it. And so it says match the following abnormal response patterns or respiratory patterns with its clinical description. So, for example, the Kussmaul respirations, when I come here, this is a deep, rapid labored respiration with metabolic acidosis. Then we come to bradypnea. So let's say bradypnea is, hold on. So the Kussmaul is the rapid respiratory, no, the one with labored, and you can simply just interchange. And as for this one, we go for, okay, so now that we have everything, you submit, and your responses are rated like that. So when you get the responses wrong, the platform shows you what you've gotten wrong specifically. And back to the nursing care plans, we had generated the nursing care plan for jaundice. So when you open it, your problems are outlined like that. So you can simply open any, either this one, or that one. When you open a condition, for example, yellow skin color, you can say hyperbilirubinemia as a problem identified related to liver dysfunction evidenced by yellow skin and high bilirubin levels. The students I have in my class for my online tuition actually learn, revise, and prepare for exam using these platforms. So whenever we have a timetable that we follow, we simply target the condition for that particular day and we begin preparing, going through together and revise. And in their own time, they get to attempt the quizzes on this platform as well as just revise the nursing care plans on the platform. You're provided for a problem identified and the diagnosis, the goal, 4 interventions, or 5, and your evaluation at the top right there, and the list of other problems is simply listed down like that. We're going to take a short break as we wait for others to comment and invite others. Okay, and finally, let's wrap this up and close. This webinar was only valid or going to run for an hour. So now let's ponder the question as to why failing nursing exams has become very common nowadays. Basically, the first thing that we're going to talk about is inconsistency. Most nursing students are inconsistent. Studying is supposed to be a lifestyle. Studying should not be a one-time thing because memory is retained whenever you memorize stuff. When you study a certain topic, you need to study it again. You need to practice with questions. Stay consistent by studying every day. The other reason why most nursing students fail is because they do not have a plan. They do not have a written plan on how they're going to utilize, for example, the period they have between their exams and the current time, of which we had addressed to say this platform caters for that. How specifically? It does because there is a timetable that you can structure on the platform, exclusively found in the exam ready, in the study mode. So having a plan as a student is very important, and you can generate a plan on the platform, and you can always go back to the plan, see what you're supposed to study on that particular day. Study plan is right there, and you prepare for exams just like that. The other reason why nursing students usually fail exams is because they do not evaluate their competence against real questions. They don't practice questions. Whenever you study something, you need to test your competence against what you've studied, which is why the platform also caters for that by the board mock exams that we were just talking about earlier, which you find on the platform under advanced tools. And that board mock exams that we were talking about allow you to revise, go through as many topics as you can. Select the mode that you want, fill in the blanks or matching questions. Let's say if you want multiple choice, you have a list of quizzes that will be stored, meaning you can always visit them back. For example, we wanted mania. We had generated mania before, so just simply open it. The primary indication and gold standard for the treatment of acute mania in patients with bipolar disorder is, let's say, for example, haloperidol, because mania is a psychiatric disorder, and say submit answer. So it tells us to say lithium carbonate is the first line. So whenever you get an answer wrong, you are given a correct answer. So this is not just any type of practice quiz, like most cases where you get an answer wrong, you move on to the next question. No, you always get corrections in real time. And there's no better way to learn than learning through our own mistakes. And last but not the least, other reasons why nursing students fail exams so easily nowadays is because they do not discuss with friends. Interacting with others helps you test your knowledge, your competence, and your way of understanding things differently. It's important to get opinions from other people. You can use artificial intelligence platforms, you can use group discussions, or you can simply just visit lecturers and have them give feedback over your work. Sometimes test yourself and your competence by attempting a question, write it down, take it to a lecturer and ask them to just put comments and feedback. That is very important as it helps you know where you're making mistakes and where you're proceeding. So I will now be announcing those that are getting free accounts as of today, the ones that were active in our comment section. So we've got Andrew. Andrew, great work. You'll be getting a subscription on the platform. And we also have Levi. Thank you. You'll be getting an extension on your platform. You'll be getting an extension on your account as well. So this is where our webinar ends. Unless there are any questions, you can always leave a comment on this live session because you'll find it on our YouTube channel, and the rest is going to be attended to. Thank you very much for being a good audience. See you in the next webinar, which we're going to have on a date that is going to be communicated.